5,000 years ago, Africans were performing brain surgery, drilling holes into human skulls, and the patients survived. We know because their skulls show healing. Follow Afrithrone TV because African surgeons were operating on brains 5,000 years ago. Trepanation, the surgical practice of drilling or scraping holes into the skull to access the brain. Ancient African skulls from Kenya and Algeria show evidence of trepanation dating back 5,000 to 7,000 years. Why did they do this? Medical reasons. To relieve pressure from head injuries, to treat headaches, possibly to treat mental conditions or epilepsy. The remarkable part? Many patients survived. We know because the bone shows signs of healing, new bone growth around the holes. This means the surgery was successful. The person lived weeks, months, even years afterward. Performing brain surgery requires knowledge of skull anatomy, precision tools, antiseptic techniques to prevent infection, and post-operative care. Ancient Africans had all of this, 5,000 years ago. The tools? Stone implements, sharp obsidian or flint, precise enough to cut through bone without damaging the brain. Some skulls show multiple trepanation holes, meaning the person survived one surgery and underwent another later. This wasn't experimental butchery. This was practiced surgical technique, refined over generations. Trepanation was also practiced in ancient Peru and Europe, but African examples are among the oldest. Egypt's Edwin Smith papyrus from 1600 BC documents surgical procedures, including skull injuries, but physical evidence shows Africans were doing this 3,000 years before that papyrus was written. Brain surgery, 5,000 years ago. In Africa, with stone tools, and patients survived. African brain surgery, 5,000 years ago. Patients survived. Follow Afrithrone TV for medical techniques that predate history.